Welcome back to my channel, Pattern of Good Works. My name is Donna, and today we'll be taking a look at chapter number 4. And the book is called The Specialty Practice of Rehabilitation Nursing, the Core Curriculum, the 8th edition. We will be on page 41. So on page 41, it talks about the specialty practice of rehab nursing extends beyond a confined time or place, including acute, post-acute, long-term care, community home-based, and other settings such as inpatient, clinical, academic, and research facilities. Understandably, best practice becomes better practice when a combination of theory and model is used to frame the standard of care for each consumer. It goes on to say of rehabilitation. So it's sharing that there are multiple models and theories and guidelines that we look at as registered nurses to ensure that we can clearly take a look at the patient's needs as well as how can we make their needs a priority. So on the bottom of page 42, you will find one of the interdisciplinary theories, which is known as the Gestalt theory. And it says, as described within the Gestalt theory developed by Max Wertheimer in the 1920s, the whole is greater than the sum of its parts. Pieces and parts fit together to produce thoughts, actions, and structures such as family units. So in chapter number 4, it really looks at all of the parts that go into making an individual who they are. So we then go into developmental theories, and there you'll find Sigmund Freud. And Sigmund Freud's theory really looked at Freud's psychosexual stages of development. So for oral phase or stage is from 0 to 2. And this is where the infant achieves gratification through oral activities such as feeding, thumb sucking, and babbling. From ages 2 to 3, the child learns to respond to some of the demands of society, such as bowel and bladder control. In the phallic stage or phase, 3 to 7, the child learns to realize the difference between males and females and becomes more aware of sexuality. Latency phase from 7 to 11, the child continues his or her development, but sexual urges are relatively quiet. And then from 11 on to adulthood, it says the growing adolescent shakes off old dependencies and learns to deal with maturely with the opposite sex. So you see, this is a theory, and the person is developing from infancy all the way to adulthood. Another relationship theory or theorist is Alfred Adler. And Alfred Adler looked at the birth order. So the order in which you are born to a family inherently affects your personality. So these theorists are looking at how we are shaped from our family unit, our position in the family unit. It's also looking at are you firstborn? Firstborn children who later have younger siblings have it worse, it says. Middleborn children have it the easiest. The youngest child, like the firstborn, is more likely to experience personality problems during adulthood. So integrating tendency describes behavior in which one person gravitates toward another person. Another social theorist, a social learning theorist, is Erik Erikson, which we know for sure will be on the examination. And Erikson suggested that interactions between parent or a caretaker and child are essential to healthy psychosocial growth. So again, from birth or infancy all the way up to adulthood, that's what Erikson is looking at. And for Erikson specifically, he's looking whether or not, and you will see that on page 44, in infancy, it goes from 0 to 12 months, trust versus mistrust. Toddler from 12 to 36 months, autonomy versus shame and doubt. Preschoolers from 3 to 5 years, initiative versus guilt. And then school age, 5 to 12 years, industry versus inferiority. In adolescence from 12 to 18 years old, we see identity versus role confusion. And early adulthood from 18 to 25 years old, you'll see intimacy versus isolation. And adulthood, you'll see ages 26 to 65, generativity versus stagnation. And lastly, older adults older than 65 will have to be challenged with integrity versus despair. And I find that if individuals do not accomplish that age appropriate task, they fall into, instead of coming out on the positive end, they will be on the negative end. So instead of, for example, with infancy, instead of trusting, learning to, when the mother comes or the caretaker comes, they bond with the individual. If they fall into mistrust, they never have that bond and they never get out of that stage. They stay stuck. I like to think of it in that aspect. So we see how developmental theorists, and you will find all the theorists, whether it's behavioral like Pavlov, or interactional or cognitive like Piaget, you will see all of the theorists on page 44 and 45 within the book. So on the bottom of page 47, you will see consonance. It says consonance involves having environmental demands and expectations in accord with one's capacity to respond, a sense of comfort, or consonance makes optimal development possible. Emotional discord or dissonance occurs when a situation is in conflict with expectations. So, what's an example of cognitive dissonance? You believe that reducing your sugar intake would be great, a great idea. However, you purchase chocolate donuts every morning before work. That is an example of cognitive dissonance. So it's important to know whether or not your patient is dealing with cognitive dissonance. It says here on page 48, conditioning and learned behavior can be helpful when redirecting the focus toward healthy or healthier behaviors. Dissonance happens at many levels, such as conflicts between rational and emotional reactions to stress. So we know patients in rehab have had either a crisis or some sort of stressful event. Knowing this information will help us to ensure that those health promotion behaviors are accepted by the patient. We also want to know when we're gathering information during an interview whether or not the patient is presenting with cognitive dissonance to ensure that we can treat them most effectively. We want to get their values, we want to get their beliefs. What are they truly thinking in order to get them on that road to wellness? So, in summary, this week we looked at models, we looked at theories, we also looked at consonance, and we also looked at cognitive dissonance. All of this information helps us to be able to better treat our patients. Knowing their true values and their beliefs will help us to promote wellness in an attractive way. I thank you for taking this time to go along with me on this journey. I hope that you will come back next week so we will continue our study group for the CRRN exam. Take care and be well. Bye-bye.